This is the kidney model. We're going to start with the renal capsule. It's the outside. The renal hilus is the indented area of the kidney. The renal cortex is the light stained portion. You can see it on this model, and on this model it's the upper part, the lighter stain. The renal columns are in between what would be the renal pyramids. You can see here, these are the renal columns as they come through. Then we have the medulla, which is the darker stained area. You can see it here on this model. Renal pyramids are here. And like I said, these are the renal columns in between the pyramids. Then we have the base, which is towards the front of the pyramids. And as the pyramids go in towards the calyxes, you have the apex pilia of the pyramid. As they go in. Base, apex. Base, apex. They go into minor calyxes, which you see here, which lead into major calyxes, which take you into the renal pelvis, and then we go, let's see, what are we going to go next? Blood vessels. We'll do the blood vessels. Okay. Blood vessels. You will start first with the aorta, because the blood comes from the aorta. Then you have your left and right renal artery, which on this model we just have one side. So make sure you say left and right renal arteries. Then it goes into the segmental arteries, which branch off and go in different directions. Then you have this little short one right here is the lobar artery, which goes into the interlobar artery. And you can see it over here also, interlobar, to the arcuate artery, which goes around here, and you can also see it over here, arcuate artery. And it goes into the interlobular artery, which looks like a tree. You can also see it on that one. Which branches in to what you can see here is the afferent arteriole, which goes in the afferent arteriole here. And you can also see it over here. And also afferent arteriole right here. Then it feeds into the glomerular capillaries. You see right here, and also over here. And then it comes out to the branch of the efferent arterioles, which you can see right here, and also over here, efferent arterioles. The efferent arterioles feed two capillary beds. One in the cortex, the peritubular capillaries, and in the medulla, the vasa recta. Then, after it feeds both of those capillary beds, flow goes to the interlobular vein. From the interlobular vein to the arcuate vein. From the arcuate vein to the interlobar vein. Then from the interlobar vein, as you can see over here, then it goes back to the left and right renal veins and out to the inferior vena cava. Okay, so that's the blood. All right, this is a renal corpuscle that we have here, or this whole thing, you can call it Bowman's capsule or the glomerular capsule, whichever one you prefer. Okay, we're going to start with the top. Up here we have the distal convoluted tubule that you can see here, and you can also see on this model right here. Okay, and these cells right here on the distal convoluted tubule are called macula densa cells. Just these at the bottom. Then you have your afferent arteriole, and these cells in this area right here are the juxtamedullary cells, or JG cells. And on this side is again your efferent arteriole. Right here we have what's called podocytes. Anyway, podocytes. These whole things are your glomerular capillaries inside this thing. This is just stripped down version of this side. This side is stripped, but it's just to show the podocytes. Okay. Then we have the proximal convoluted tubule, which leads out, and you can also